I'm Anna Hartley and I'm the Director of Public Health for Wakefield District. I really want to welcome Ofsted today from all the partners. We're really proud of the journey that we've had and we're keen to tell you about some of the things that have happened over the last 3 years. From a public health perspective, I think there's 3 key things that I wanted to highlight. Firstly, the children and young people themselves. So the voice of the child is now absolutely at the forefront of everything we do. We've got used to seeing children at our partnership boards, on our interview panels, and they also deliver training. I think the second thing is around leadership. So the children's team have absolutely demonstrated time and again that they are tireless in their quest to give children and young people in Wakefield the best possible outcomes. They've done that with very little ego, they've worked with partners sort of hand in glove, they've listened, and that's just been a really, really kind of interesting and valid way to be over the last 3 years. And the third thing for me, as I'm a Director of Public Health, is around the data. So we have seen a massive, massive emphasis on the data, capturing everything within the Children's Directorate. Not only has there been a kind of forensic look at kind of outcomes and how those can be demonstrated, but that data has also been shared transparently throughout a number of governance processes. And I think that gives us assurance as kind of corporate parents or kind of corporate colleagues that actually things are improving for children in Wakefield. They have improved significantly, and that's been a really rewarding thing to watch.
We feel in Wakefield that we really are now working together. We've got that triangulation and joined up thinking, and that's really important for our pupils and our families to have that. We feel that it's better than ever, it's stronger than ever. We have that choice now of being able to know who we can call to. There's been lots of changes over the last few years, and the changes have really had an impact on our families and our children. Having a linked social worker has really made a difference to our families and our children. We have a linked social worker who knows our school and knows our families and our social context, and that has really made a difference to our children. As a school, we also receive BRT's monthly partnership updates, which are really good. They give us a real view of what's happening across all services in Wakefield. Before, we sort of felt a little bit isolated in terms of just education, whereas now we can see what's going on in social care, for children in care, for fostering services, everything else. That's really helped us to really have that bigger picture of what's going on in Wakefield for our children and young people. In addition to the monthly update that we get, we also have a daily update from Andy Lancashire that gives us information that relates just to schools. So that's really helpful as well, because it's almost like it's been cherry picked out what the things are that are key for us as schools, and that's been a really good communication method for all our schools. Speaking to other head teachers in the community and locality, they also really feel that's a real benefit for us.
Children and young people in Wakefield have a stronger voice to influence the way in which we make decisions. They're supported by an integrated whole system workforce that puts them at the heart of everything they do. And so there's some of the progress that we've made in the way in which we work together will really start to identify those problems early. So the children and young people's integrated teams connecting with local GP practices in a way that we've not done before will really help the children, the young people and their families get the support they need. Our ultimate aim in Wakefield is to make sure that every child, every young person and their family has the best start in life.
I think one of the strengths of our partnership and executive in Wakefield is the consistent relationships that we've got. We work well together. We've been driving this for the best outcomes for children as a team for quite a long time now. We've sort of flexed resources, we've realigned staffing, and now we're really focused around the 6 school pyramid model within the district, linked into education, child social care and the police, to work together in 6 localities, linking into my neighbourhood policing teams, where we really are discussing, sharing information and trying to get upstream, provide the best interventions for children and families at the earliest stage possible to protect harm in the long run. And really, this is something that I think has been really effective within the district and the partnership. Throughout COVID, we've obviously had some challenging times over the last 18 months. Here in Wakefield, we've developed the Vulnerable Children Tracker so that we, as the executive and managers, could make sure that no children throughout COVID slipped through the cracks and dropped off services. And again, the high-risk children were visited, whether that be by education, social workers or the police, to make sure a combination of all those, to make sure that they were fully protected and in our line of sight throughout this challenging and worrying period.
The partnership working has made a great difference. We're positioned centrally in the partnership. We're engaged and embedded and immersed in the Wakefield Families Together programme. So we're really strengthening our 0 to 19 services to have a wider reach, to pick up all the preventative work, take part as an active partner in the early help work as well.
In the Wakefield Families Together partnership, we've set ourselves a challenging ambition to implement a service model that we think will be a practical example of how we move towards a better integrated service. And in my organisation, South West Yorkshire Partnerships Foundation Trust, we provide child and adolescent mental health services. And our practitioners now in that service model work as part of the team around the school, ensuring that specialist advice is provided at an early stage in discussions around how we provide better services and support for children and young people to ensure that we prevent as far as possible children and young people needing to access specialist support further down the line. And we think that model is one that's right for our children and young people, and it's been a challenge to implement, but we've come a long way with partners to ensure that that vision and that service model is owned importantly by our practitioners.
I think the team around the school and the Wakefield Families Together mean that head teachers now can get the right people around the table at the right time to make those positive differences for our children and families. You know, we know who we need to contact and we can act swiftly in order to kind of stop things getting to crisis point. And I would say probably the biggest difference is the whole communication and the fact that head teachers now, the feeling I get when I sit and chair the meetings of the early years heads is that you know, we feel consulted with, we're communicated well with, and it's just better for us from an education point of view to be able to support the families that we need to support really well.